Everyone. So the question for today is a 30-year-old male presented with painless enlargement of the testes since 1 month. Blood investigations reveal increased level of LDH, lactate dehydrogenase. The gross appearance and the microscopic appearance of the excised tumor is shown below. What's your diagnosis? Yolk sac tumor, choriocarcinoma, seminoma, teratoma. Okay, so it's basically a man in the third decade with a testicular tumor. Now look at the gross appearance. LDH is like a non-specific thing. It can be elevated in many conditions. Okay. Look at this one. This brown one, it's the peripheral normal testis which is preserved. This one, this entire one, this is a testis which is cut open and this is the tumor. So how is it appearing? It appears uniform. So this we describe it as a homogeneous gray-white appearance and it's bulging from the adjacent testicular parenchyma. So this is how a typical seminoma looks like, and this is sometimes referred to as cut potato appearance. Okay, it's called cut potato appearance. Where do you have cut cabbage appearance? In Phyllodes tumor in the breast. Okay, there you have cut cabbage appearance. Here you have a cut potato appearance. But what is the microscopy showing? So are you able to see the cells which I am drawing an outline? They look different from the adjacent cells. So these are lobules of cells. You are able to see some empty spaces. They are cells with clear cytoplasm, right? So whenever you have cells with clear cytoplasm, think of a germ cell tumor, and all these are septae. This is a septae which is having dark cells which are lymphocytes. So you have lobules which are composed of polygonal cells with a distinct membrane, some with many with nucleoli, and a clear cytoplasm with lot of lymphocytes. Think of seminoma, especially this age group. Okay. So sometimes you can get even a granulomatous reaction in seminoma. So to summarize, you have a 30-year-old male with a homogeneous appearing testicular tumor with a cut potato appearance, microscopy showing clear cells with lot of lymphocytes. Okay, what's your diagnosis? It's a seminoma. So your diagnosis is a seminoma. Okay. Now look at this. Usually we don't do a FNAC for a testicular tumor. Okay, it's actually contraindicated, but if at all you get to see a cytology of a seminoma, how does it appear? This is how it appears. Any clue? There is a typical description for this. This we call it as a tigroid background. So remember, tigroid background is seen in a seminoma. Look here, the background, they have alternate dark and light areas. This is called tigroid background. Okay, so seminoma is a tumor which microscopically shows clear cells with a clear cytoplasm and with lymphocytes, whereas cytologically they can show cells with tigroid background. So this is what you should know about seminoma. And seminoma is a germ cell tumor which arises from germ cell neoplasia in situ. Okay, it's different from your spermatocytic seminoma. This is a classical seminoma which I am talking about. Okay, next is you can have reduplication of short arm of chromosome 12. So this can be associated with isochromosome 12p. That's the genetic abnormality in your germ cell tumors. So having discussed the tigroid appearance, you can get tigroid appearance in other parts. So the tigroid appearance of your myocardium is seen in fatty change. So fatty change of the heart can be seen associated with hypoxia. So you have normal red areas and the deposited fat. So you have alternate red and yellow areas. Red one is a normal myocardium, yellow is a fatty change. This is called the tigroid appearance of the myocardium or the tabby cat appearance. Next you have the tigroid appearance in the cerebellum. This is associated with a cerebellar gangliocytoma. This is also called Lermite-Douglas disease. This is called Lermite-Douglas disease. Okay, cerebellar gangliocytoma, dysplastic cerebellar gangliocytoma. Next you can get it in retina as well. Whenever you have myopia, the retinal pigment epithelium will thin out, so you can see the choroidal vessels. So that's called tigroid fundus, which you can see in myopia. Thank you.